Hi Charles, it's Dr. Steps inside this right knee of yours. Give you a tour and see what we can do to hopefully help you. First you see this metal probe. I know that metal probe looks awfully big. It's actually very small. It's only 3 millimeters in size. Next you see this blue tube or cannula. That hole there is also 3 millimeters in size. We're constantly irrigating your knee out with fluid, getting rid of anything that may be loose or floating around. Next we're going to look at the surface, which is called the plateau, medial tibial plateau, inside part underneath are those air bubbles. Again, a little bit of softening the cartilage there. You see that? That's a little bit of arthritis. Do you see that area right there? Again, kind of rough. Again, not down to the bare bone, which is good. Just get rid of those air bubbles. Now we're going to rotate the arthroscope up and look, again, the inside part of the knee. This is called the medial femoral condyle. Inside part of the knee. Look how nice and smooth that is. That's exactly what you want to see. Looks like a hard-boiled egg. That's it. The way in the back part of the knee, trimming out some of this, what's called the medial meniscus, way out of the back part of the knee. Again, a lot of damage in this area. I'm going to show you right here. And now, all that area. Oh, this is all torn meniscus. So what we do is we take our little scissors and we just trim out the damaged portion. So that gets caught up above and down below, which causes pain. Hold that. And what I do now is I suck out these pieces for us. There we go. I still have more tearing in the back. And again, take my little instrument here. Just trim out way, way in the back. So here's that tear right there on the very inside. You can see the cartilage that you damaged right there. So unfortunately, it has sheared off a little bit of the articular surface. So I'm going to take out this tear. You can see, look how beaten up this is. A lot of damage here. Do that, suck out those pieces. There we go. And in a second, I'll take my shaver, but I need to get a little bit more of this damaged meniscus. Look at all that big tear. Again, this is called the medial meniscus, the one on the inside. Trim out those pieces. There we go. Now I'm going to take my shaver in a second. The shaver starts smoothing off some of these rough surfaces. Our blue tube, here comes our shaver. And just start smoothing off all this rough surface. Again, got the shaver now smoothing off that rough surface. Again, they sheared off a little bit of that cartilage right in here. I want to smooth off these rough edges, but it looks like it is down a little bit to the bare bone, right in that area. Again, you can see sort of the normal cartilage here, but Charles, look in here, you did shear off that cartilage right in here, so I'm smoothing off a little bit more. I'm going to take a burr. I am going to have to scrape this because you can see there's no cartilage left. And you want to bring sort of a protective cap here, if you will. So we're going to scrape it, help bring some new cartilage into it. What we've done now, we've scraped this area, and watch in a second, Charles, you're going to see this bleed, and as it bleeds, it'll bring some new cartilage to this area. Put the water back on now. So again, this is all on the inside part of the knee that we had to scrape. It looks pretty big, but it's maybe about 2 centimeters by 1 centimeter. So again, from all the way from here, all the way up to there. Charles, this is the middle part of the knee. This is called the ACL, anterior cruciate ligament. Good strong fiber. See the attachment right there, and the attachment to what we say the lateral wall right in here. So that's perfect. The posterior cruciate ligament is right there. See those fibers running underneath it? So that's the posterior cruciate ligament behind it. Right there. Anterior cruciate ligament there. Looks perfect. Let's go to the outside part of the knee and check that out in just a second. Charles, here we are on the outside part of the knee. Had a small little tear, what we say the periphery of the lateral meniscus on the outside, not as big as the one on the inside. Way, way in the back. A little bit of arthritis here. You see that rough surface down below? I'm going to smooth off this surface. Everything's going so far so good. I'm going to hold that like that. Rotate the arthroscope down. Just do a little bit of this area right here. That looks pretty good. A little bit of rough stuff up above. And now flex up the knee. There we go. Now slowly straighten it out to make sure we don't have any tearing of what we say the cartilage on the outside of the lateral femoral condyle. Look how nice and smooth that is. That's perfect. That's exactly what you want to see, so it looks like a hard-boiled egg. So that's perfect. Let's go by the kneecap and check that out in a second. Charles, here I've got your kneecap, and you can see up above, look at this, you have a little bit of arthritis on the kneecap. The kneecap is up above. See that stuff hanging down? Again, some damage to what we say the articular cartilage. That's what's called grade 3 convolution. Now the groove that the kneecap slides in is right here. Now it's pretty good. See how nice and smooth that is? Smooth, what we say articular surface. That's what you want to see. Now there's our blue tube again. There's that arthritis with the kneecap. Now again, the leg is straight, so we're going to go to the outside part of the knee and go way back here. Make sure we have no loose floaters of cartilage or loose pieces of anything way back here, which you do not, which is good news. So as we come up here, you can see your kneecap. There's the kneecap again. That's normal cartilage, but then as we come over here, you can see the damage to the undersurface. There's our blue tube. Back this up a little bit. And now rotate down, making sure there's nothing loose over there, which there is not. So in a second, I'm going to get my shaver in there through my blue tube, and through that we're going to start smoothing out the undersurface of the kneecap. Again, a little bit of arthritis also around the kneecap, and you also had some, as we say, on the inside part of the knee. So let's smooth off all these rough surfaces for you. You can see those smoothing out the undersurface of that kneecap. Again, it's not down to the bare bone, but a little bit more right here. Just want to smooth out all these rough surfaces for you. So Charles, we're about done here. We're going to spend a few minutes now just irrigating your knee out with lots of fluid. Everything's gone just fine. You had a big tear in the meniscus on the inside part of the knee, and unfortunately you also sheared off a little bit of what we say articular cartilage. So it looks like that came from the meniscus being torn and kind of rubbing on the bone. So we smoothed that area off and we scraped it. So because we scraped it, we're going to have to actually keep you out of tennis, I would say, for at least 3 months, because we don't want any running, jumping, cutting, or anything like that with your knee, and definitely no housework for probably 6 months. So it's going to be really important we get you into a physical therapy program after this, and get your knee moving, get your strength back, and I think we get you back to tennis and all those activities that you like to do. So again, we'll spend a few minutes here just irrigating your knee out with lots of fluid. Everything's gone just fine. We'll call your wife and let her know we're finishing up. We'll see the covering in just a minute.